women are increasingly opting to freeze their eggs to preserve their fertility. Many believe this will allow them to focus on careers or look for the right companion, enabling them to have a child later in life. This plan may seem appealing, but according to experts, the chances these frozen eggs will produce a baby are low. For more insight, we're joined by Dr. Glenn Shatman. He's Associate Professor of Reproductive Medicine at the Weill Medical College here in New York. It's also Cornell University. Welcome, Glenn.
Good morning. Thank you.
Well, first of all, let's clear this up. We're talking about freezing eggs, not freezing embryos. Explain the difference.
Correct. Well, an egg is actually an unfertilized. When it's fertilized, it becomes an embryo. Embryos are much more hardier and freeze a lot better than eggs do.
So basically, someone that doesn't have a partner, that doesn't have a sperm donor, if we will, can come in, you give them some medicine, take out their eggs, and put them in a freezer for use at a later point. Is that correct?
Well, that's the theory, yes, that's correct.
And what's wrong with that? Sounds great to me.
Well, it sounds great. The problem is the majority of women coming in, by the time they make the decision to freeze their eggs, they're already on the reproductive decline. They're in their late 30s, 38. At that point, the eggs don't freeze and thaw very well. The decision or the time to do it is in the early 30s or late 20s. Most women aren't ready to do it at that point in time.
Right. Now, I understand there's some clinics, specifically in Boston, that are taking eggs from women in their 40s when it seems a little dubious to be doing that. You're talking about your 20s, and we're talking about a company that's charging thousands of dollars to take eggs from women and giving them, is it false hope that they're going to be able to have a child later on?
Well, I think what happens is they extrapolate experiences from other people and say, okay, they have, an 80% survival of these eggs, and therefore we should also, although they're not tested, obviously. The problem is that many of these women that are going to freeze their eggs, those eggs haven't been thawed or fertilized or transferred back in. So the actual success rates are not really known. In fact, if you look at the overall success rates nationwide in the literature, there are fewer than 200 babies born from this technology. So per egg, the average chance of a child being born is 2 to 4% per egg. That means a woman has to freeze a lot of eggs before she has a decent chance of conceiving a pregnancy with those frozen eggs. The other problem is those are young women. So women in their early 30s, 32 and under. If you're 38, the chances are going to be significantly lower than that. As women get older, they take the fertility drugs and they don't stimulate as well. So a young person might get 20 or 25 eggs from a single IVF cycle. The person in her late 30s is going to have to do 2 or 3 or more cycles to get at least 20 eggs to freeze, which is what is recommended by these companies.
Well, let's talk about the business, if you will. Are we playing off of women's fears of having children? I deal with this. I'm a gynecologist also. I deal with this every day. People are worried that they're getting older. They have career on one side. They have children that they want to have on the other. It's hard to mix the two. And then you have these companies saying, "Oh, don't worry. Just come on to us. We'll freeze freeze your eggs. We'll put them in the freezer. You go do what you want and come back when you're 45 and have a baby." Is this false advertising? Is anyone looking into this?
Well, certainly the American Fertility Society or the American Society for Reproductive Medicine has come out with a guidance document, essentially, that says this should be experimental. Women should be told of the experimental nature of the low success rates with this technology, and it should not be used to delay reproductive aging. It's really beneficial for cancer patients, somebody who's going to go through surgery, where in the next few weeks or a month, they will become sterile from the chemotherapeutic agents or the surgery they're going to undergo. And certainly that's their only option, their only hope. For other women, if they're in their late 30s, let's say, they might make choices based on the false impression that they have a good chance of these eggs becoming babies in the future. And those choices might be regretted later on in life when they realize they are 45 now, they have no chance of conceiving with the eggs they have left. And the reason they delayed was because they thought they had eggs in the freezer, and now those eggs really have a very low chance of being successful. And I think there's going to be a lot of regret later on in women in their late 40s who are going to make wrong decisions based on that false hope of those eggs becoming babies, yes.
So is it fair to say that anybody can freeze an egg, but it takes a genius to thaw one out?
Well, I think it takes a genius to freeze it and thaw it successfully, yes.
Well, let's go through some options for women watching. A 35-year-old woman watching, no partner in sight, doesn't really want to go and fertilize an embryo, so that would mean going to either a sperm bank or getting somebody to donate sperm. Give me some advice for somebody watching. What can they do?
Well, I think what women have to realize is that they're born with all the eggs they're ever going to have in their life. And throughout their life, and even in their 20s, fertility declines every single year. In their 35, it declines much more rapidly. And over 40, it's very difficult to conceive a pregnancy, if at all, for most women. So I think based on the age of the person, if they're really considering having children, they should consider using the eggs they have currently. If 35 to 40 or 35 to 38, let's say, their chance of actually having a successful outcome with a frozen egg that's not fertilized, but an egg that's frozen, is going to be on the order of 1 to 2% per egg. So I certainly wouldn't, and technology is not there yet, I certainly would not base my decisions on those frozen eggs. So I don't think she should change her lifestyle. If she does freeze the eggs, she shouldn't change her lifestyle or make different decisions based on having those frozen eggs in the freezer.
And one last question, since I have you. Let's go through the misconception that if a woman takes the birth control pill, that she's kind of saving her eggs. Can you dispel that?
Well, actually, as I said, a woman is born with all the eggs she's ever going to have in her life. If you count up all the ovulatory cycles a woman ever has, in other words, the number of eggs she's going to ovulate, it's only around 400, even though she's born with a couple 100,000 eggs. Every month, the woman loses a certain number of eggs or percentage of eggs, even though she ovulates only a single egg. So whether you take a birth control pill, whether you take any other medication to stop your menstrual cycles, you will still lose that many eggs every single month, whether you ovulate an egg or don't ovulate an egg. So those eggs are, the saying, if you don't use it, you lose it, essentially happens to every single woman every month.
Great. Well, Dr. Chapman, thank you for joining us today.
Thanks for having me.
Great. And we hope you found this edition of Healthy Life informative. To find out more on this story and other health-related topics, we invite you to go to our website at abcnews.com. And as always, we also encourage you to personally get involved in our program by visiting the Dr. Tim on Call section of our website. There you can send us your feedback and questions by video or email and suggest topics Dr. Tim might address right here on Healthy Life. Thanks for joining us today from all of us at the Healthy Life production team. We hope you stay healthy, and I'll see you next time.